For every new law, there's almost always a group of opponents who resist the proposed change. In politics, sometimes we must look at the greater good, and in order to help people, must risk angering a few. There are some political ideas and laws, though, which anger a very large portion of people and only help a smaller portion. I would argue that the Patient Protection and Affordable Care Act, otherwise known as Obamacare, negatively impacts just as many people as those that it helps. This can be seen through decreased personal freedom and increased personal choice. Let's first look at the impact Obamacare has upon the elderly, an age group we should be striving to protect and see well cared for. According to the Heritage Foundation, a research institute founded in 1973, the Affordable Care Act cuts an estimated $716 billion from Medicare over the next 10 years. These savings are not taken out to be used for future recipients. Instead, they have been cut in order to fund the spending created by Obamacare. Unfortunately, the Heritage Foundation also states that the cuts necessitated by Obamacare damage the Medicare Advantage program, something relied upon by many seniors, and jeopardizes its future success. But all age groups are affected. An article published in the LA Times a few months ago says that it expects doctor options to be limited going into 2015. This same article states that even as enrollment numbers increase, a good portion of individuals continue to complain about being offered fewer choices of doctors and having no easy way to tell which ones are available to their respective plans. Certain individuals have even been saddled with enormous debts after seeing doctors who, according to insurers afterwards, were out of network. Since directories listing in-network options are scarce, this mistake is understandable. In the words of Mary Edwards, interviewed by the LA Times, this is part of the Affordable Care Act that doesn't quite work yet. This game of who's in and who's out is tiresome. The limited choices of doctors offered through Obamacare can be a burden to many. In addition, the Act limits choices of hospitals even to the point of excluding certain cancer treatment centers. In the land of the free and the home of the brave, this lack of choice is rather unsettling. In the realm of business, Obamacare has also caused a good deal of upset, though later remedied in some cases. Remember the Supreme Court case regarding Hobby Lobby? In the beginning of the ordeal, Hobby Lobby, which is a company owned by Christians, was being mandated by the government to provide contraceptives for its employees, something which went against the owner's personal beliefs. The company's healthcare plan provided the vast majority of drugs and devices mandated by the government. However, they objected to 4 which could actually terminate life. In doing so, they risked paying huge fines and perhaps having to even go out of business. Fortunately, the Supreme Court ruled that, for religiously founded businesses such as Hobby Lobby, this governmental intrusion was unconstitutional. However, the case was a sad reminder of the power government has gained in the previously private field of healthcare. Aside from personal freedom, though, something else is lost through Obamacare: finances. The out-of-pocket costs of healthcare are extremely high with the Affordable Care Act, with deductibles doubling and sometimes tripling before insurance begins to cover the cost. The health insurance policies offered through the Affordable Care Act do not in any way live up to its name. In fact, the majority of individuals will experience premiums twice as high. There is a penalty tax for those who choose to not enroll in the program, something which serves as a motivation for those considering whether they wish to participate. However, the penalty tax is not even necessarily as expensive as the cost associated with enrolling in a plan. This healthcare law, signed into effect by President Obama in 2010 and upheld by the Supreme Court in 2012, may increase insurance coverage for certain individuals who did not previously have insurance plans. Unfortunately, this law has had a rather detrimental impact upon citizens who did already have healthcare plans, raising costs and decreasing choices. Many of Obamacare's supporters, though, will point to the fact that increased enrollment numbers are seen since the implementation of the Affordable Care Act. I am not arguing that fact. I very well see that enrollment has increased. After all, people are being fined for not enrolling in an insurance policy. Thus, it makes perfect sense that enrollment numbers would have been higher. However, I am arguing that the quality of care seen by many individuals has decreased from pre-Obamacare days. In the words of Abraham Lincoln, you can't make a weak man strong by making a strong man weak. While the Affordable Care Act is not completely bad, one of its main flaws is this. Through greater governmental control in the previously private field of healthcare, individuals experience a very small portion of wealth redistribution, something which, while benefiting the lower income people who are receiving subsidies, may end up harming a lot of other individuals. That is why I am arguing, through examining the impact upon Medicare, upon business, the increased personal cost, and the decreased personal freedom, that Obamacare is hurting just as much as it is helping. Thank you.